if you were sorry guys, the disturbance. So you were hurt. What happened? You were cardiac, your walls stenosis. I was so your lip ventricle will be hypertrophy, and it will goes to gradually with time. It will goes to cardiac failure. Your contraction, left ventricular contraction will be decreased, and it will lead to cardiac failure. Is not a disease that will cause death, and it may cause death in a few days, but it leads to it's a chronic condition. Okay, so it leads to many days. If you have cardiac failure and your force of contraction, because your body will compensate those contraction to increase blood flow, and gradually with time it will be what paid out your contraction, and your ability and your cardiac failure will be chronic. Okay, so let's go in detail. I said like okay, I said what I said where I was okay, damage heart part. That is external pressure. There's also another reason for cardiac failure. Okay, external pressure around the heart, like in cardiac tamponade, like when there is pericardial effusion or pericarditis. Because of pericarditis, there is fluid accumulation in the pericardial cavity, or there is blood accumulation due to infections or due to pus accumulation. So it will cause what? It will increase the pressure around the heart, and this increase in pressure will cause it will cause what? The relaxing, like the in diastolic stage of your heart your heart cycle. Okay, it will not relax fully to accumulate much blood, so it is called diastolic heart failure. There are also two types of blood on the basis of which stage in which your heart not function properly, in which stage of your heart cycle. So it is called diastolic heart failure. We will discuss in detail. Okay, no, don't be confused with this, just learn. Okay, and another is what? Oh, okay, so external pressure around the heart, vitamin B deficiency, very, but it's called high cardiac output failure. In very, what happened? In very, your total peripheral resistance, your total peripheral resistance decreases of your body, your all systematic blood vessels. So it will so it cause high cardiac. We will discuss in detail. Okay, I am confused about it a little bit, so we will discuss how vitamin B deficiency can lead to, but it's a case of high cardiac output heart failure. The other causes is lead to decreased cardiac output failure. One is high cardiac output failure, another is, so there are many types on the basis of different factors. Okay, so vitamin primary cardiac muscles disease. If there is myocarditis or other your myocardium is not function properly because of MI is also due to your myocardium disruption, but other due to infection or other your muscles is not contracting, so it will also lead to cardiac failure. Okay, so let's go. This was just a small paragraph. I go to very detail here. I will not go too much detail because this chapter is very in detail. Every point will be clear to you guys. Or any other abnormality that makes or any and then makes the heart hyper effective pump. Like your heart is normal effective pump cardiac. It contract in it out the blood 5 liter, but any condition abnormality that cause your heart hyperactive pumping ability decreases, so it will lead to cardiac. In this way, we discuss myocardial failure caused by ischemic heart disease. Our focus will be ischemic heart disease because of blockage, any blockage of coronary artery, any coronary artery blockage. So we will be discussing this in detail. Okay. So circulatory damage cardiac. So what's your whole circulatory system uh, behave when you have cardiac failure. So let's go acute effect of moderate. Like if there is acute myocardial infarction occur, occur from some few days, you have atheroma in your left coronary artery. Okay, so your left ventricle will be what? It will be it will lead to ischemia. The blood supply will be stopped, and that part of you, that part that's supplied by the left coronary artery will be what? It will be necrosis. So it will cause what? It will lead to cardiac failure. Your pumping ability of your heart, your muscle contraction ability will be decreases. So personally, okay, so what's the acute effects? So what's the these the effects of moderate cardiac failure or acute myocardial? So if a heart suddenly becomes severely damaged, okay, severely damaged such as by myocardial infarction, the pumping ability of the heart is immediately. Is there two main effects occur? What's the two main effects? Reduce cardiac output, as I said, or damming of blood in the veins result in increased venous pressure. So definitely, if your cardiac output decreases, okay, so your heart is not pumping that blood that is going into it due to veins, like due to superior vena cava and inferior vena cava to the right side, and pulmonary veins from the lungs the left side. So what will happen if it's not eject that blood? So definitely these will be backflow of this blood will occur in the veins, and your venous pressure will be increases. Okay, so this is the reason. The progressive changes. Okay, the progressive changes in heart pumping effectiveness at different types after an acute myocardial infarction and so on. Okay, I will discuss this paragraph later. Okay, just go on. Okay, the top curve of this figure show a normal cardiac output of point A on this curve is the normal. Is the normal what? Is the normal? Is point E, and the curve is the normal operating, showing a normal cardiac output resistant condition of 5 liter and a right arterial pressure up. Okay, immediately the heart becomes damaged, the cardiac output curve becomes greatly depressed, falling to the lowest curve at the bottom of the graph within a few seconds, and new circulation is established at point B. Okay, I will discuss this paragraph, but let me finish this graph. It point B showing that the cardiac output has fallen to the 2 liter for a minute, about 2/5 normal, whereas the right arterial pressure has risen to 4 mmHg because venous blood return to the heart from the body is damming up in the what? Damming up in the right atrium. This low cardiac output is still superior to such as life for perhaps what? And this low cardiac output is superior to life for a few hours, but it is likely to be associated with painting. You will have painting. Fortunately, you will have painting at 2 liter per ml cardiac output. I will discuss acute stage lasts for only few seconds because particularly this acute stage usually lasts for only a few seconds because environmental reflex occur almost immediately and compensate to a great extent for the damage heart as follows. Okay, so let's go into this paragraphs. Okay, so if you in your normal heart, okay, if you have normal heart, so what's occur? You have 5 liter of cardiac output is zero arterial pressure, because normal arterial pressure is zero, and at this zero arterial pressure, your veins drain to this right atrium at zero arterial pressure, and the normal cardiac output is 5 liter at a point. So this is your normal heart. Okay, so what happened if your heart is acutely damaged? Okay, so if your heart is acutely damaged, like you have acute myocardial infarction in your left side of heart, what happened? Your cardiac output will be decreased to what? To point B, and at arterial pressure of 4. So your cardiac output will be almost 2 liter. because of myocardial infarction. This decreases your heart contraction ability. Your muscle is not contracting properly. And what's this point C means? So this occur after a few seconds after myocardial infarction. Your cardiac output decreases to 2, and after that your body will definitely your compensate to maintain the same blood supply, because your brain need constant blood supply, constant oxygen. If it's ischemic, so it will definitely respond. So what's happened? Your sympathetic stimulation occur, so it increase your cardiac output to point C up to 4 or 4.5 ml, and this is near to normal, and this maintain your blood supply, and this is not like it's not normal, but it's nearly normal, and it maintain your body activities. Okay, but you are, so look at this. Your right arterial pressure increases. It increase right arterial pressure. Your cardiac out will be go to normal. Why? Because the sympathetic stimulator do what? It cause what? Your sympathetic stimulation increase your heart rate. It, why? How it increase? It constrict your systematic blood vessels, and it constrict your veins, especially superior vena cava and inferior vena cava. So the blood goes to, so the more blood goes to right atrium, and this more blood will cause high pressure, and this at this high pressure your cardiac output will go to normal. So this is the point C show. After sympathetic stimulation, your cardiac output goes to normal, and when time passed, like after few days, like 2 to 3 days, your other compensatory mechanism like your aldosterone secretion increases. Your, like your RAS system, you know your RAS system by your kidney, renin, angiotensin, aldosterone system activated, and it causes more retention of fluid, and this fluid cause what? And more retention of salts in your body, and it can increase your arterial pressure, and this increased arterial pressure will cause what? It will cause increase in your cardiac output. So your partially recovered heart will be look like what? It will be goes to point D, and at 6 arterial pressure your cardiac output will be goes to point D, and it will be fully recovered. It will eject how much blood? It will eject 5 liter of your cardiac output, but at high arterial pressure. Remember the point, because all the compensatory mechanism are going on, so your right heart pressure will be high to maintain that same blood supply and that same cardiac output. Okay, so this was all about the graph, so I discussed it in detail for you, and you guys then go, if you guys want to go in more detail, so read it by yourself. Okay, so I will be go to what? So compensation for acute cardiac failure by sympathetic assumption, and I said like this will be all I have said to you guys. When the cardiac output pass precariously low, many of the circulatory reflexes discussed in chapter 18 are rapid. Like circulatory reflexes will be differently activated. The best known these is the baroreceptor reflex, which is activated by immense arterial pressure. The chemoreceptor reflex. All these are reflexes for what? Like I will go further in detail for you guys. Okay, so what's your, so if you have MI, okay, if acute MI occur, your cardiac output decreases. So so if your cardiac output decreases, it will decrease definitely. The pressure on the walls of your artery will be decreased, because cardiac output is decreased, and the pressure applied by the blood is proportional to the amount of blood. So if it decreases, so definitely your arterial pressure will be what? It will be decreased. So, and this is not this is not, it is normal, this is dangerous, because your body need a constant pressure at which all the blood supply to all the parts is going on. So what will happen, your local stimulatory, your local reflexes will be stimulated, your reflex, baroreceptor reflex is one. It will sense what? It will sense that your arterial pressure has decreased, so it will message to brain, and the brain will definitely cause what? It will cause sympathetic stimulation, and it will constrict the blood vessels, so arterial pressure will definitely increases, and which is activated by diminished arterial pressure. The chemoreceptor reflex, the central nervous system ischemic response. This is the major.